Once again, welcome back to Saharatv, and we're still looking at the coronavirus pandemic issue as events unfold here in Nigeria. With us to actually analyze some of the issues pertaining to the rising cases is Dr. Joe Odumakin, who happens to be a women's rights activist and the president of the human rights group Women Arise for Change Initiative. It's a pleasure having you on Saharatv, ma'am.
Thank you for having me.
Recent cases in Nigeria have continued to rise with respect to the coronavirus pandemic, and it's becoming disturbing. As of last night, we have 117 new reported cases and a total confirmed cases of 782 infections in Nigeria today, with 25 fatalities. It's becoming disturbing. What's your reaction to these cases, ma'am?
It's a worrisome trend, and it breaks my heart to see the rise, day in, day out. As at yesterday night, it was 117. And thinking of the fact that as a country, our facilities in terms of health-wise, our people are impoverished, the level of poverty is so high. And then the lockdown has been on for some time. But it's disturbing that as we speak, we continue to see the rise in the COVID-19. And that was why initially we kept creating awareness that we have to avoid the community transmission, person-to-person transmission. But as we speak now, it is on, so it's disturbing. It's even heartbreaking for me for the fact that a lot of our masses are not aware of the grave danger that we face as a result of poverty. You see, when some palliatives is being shared, you see a lot of our people, what they go through, they forget about either physical or social distancing, and they go all out to scramble for whatever they have. And the worst of it is that we are also being hit by insecurity. So you see, it's like the twin devil. You have the virus, three. We have the virus, we have insecurity and poverty. So when you just oppose the three, we then know that we'll have a lot on our hands.
Now, doctor, let me find out, what are the civil society doing with regards to this matter, especially considering the fact that most civil societies are armed with data, information, and recommendations? Shouldn't you be engaging governments on options for isolating those who are most at risk at this time?
In fact, the civil society has been doing a lot. My organization, Center for Change, Women Arise, we created different groups. We try to get some leaflets out through some of the market women in various dialects for people to know that there's no need for them to hide anywhere. There's a need for them to come out and then for them to speak up, especially when they have the symptoms. Because as we speak, we see that a whole lot of it is not symptomatic. But that is not to say that if it's not symptomatic, that the spread will not be there. There will still be constant spread. So as a civil society organization, we have cause to say that while the palliative is being shared, it must be done from house to house. Because when you get palliatives out on the streets, people will even forget about that, forget about hunger and any other thing. And they will start scrambling, start fighting. At the end, the spread continues. So there is a lot more that even now as we speak, some people are not, they care less about the virus. They say, well, that hunger kills faster than virus. And some of them have even said that the level of police brutality being witnessed, that is better, for them to go out to eke a living rather than them being killed by the virus. And in the process, a lot of some of our officers that are not in tune with what should be done in a decent society. We kill some of them and they will unleash mayhem. Instead of, just dialogue. Oh, why are you out? What are you doing there? Please go back. Some of them are met with bullets and they die. So the civil society, we are trying, but a lot more needs to be done to reciprocate the kind of gesture, and to also throw more light on what we are doing. Those who make laws should not flout it with impunity. So when you tell people not, to avoid either physical contact, then you organize a program, organize a burial, although there's already an apology, but I want to liken it to medicine after death. Those precautions, should have been taken, because people look up onto the government. Let them practice what they say. It's not when the deed has been done, then apology will come. Apology is okay, is belated, but we know that a lot of people will have been affected by the virus.
Let us take the issue of social distancing, especially physical distances, which you highlighted in your last comment. And we know that physical distancing in a densely populated and impoverished society, such as Lagos, where an estimated 66% of the 20 million population of people live in slum, is virtually impossible. What is your organization, for example, doing, or what initiative are you doing to reorientate people with regards to physical distancing?
Well, this time is really running out. We've made several attempts to let people know, even through the social media, through some of our leaflets, through interface, through the radio. But we know that people who live in impoverished communities might not even have access to this. So what we engage in such, and in terms of the physical distancing or social distancing is very, very important, because just one person can affect several. So we try as much as possible, to plead with the government. In the case of slums, where you have people like 10 sleeping in a room, it's very easy, for these people to be affected. So we just try to encourage the government that as much as possible, when palliative is being shared, it's not showmanship, it's not for the media bravado, but for us to know that it's genuinely and sincerely done. Let it be taken from house to house, doorstep to doorstep, and a lot of people live on what they get daily. Some are making, some are organized, some go to the markets, some, go all out to look for money. So when they are told to be indoor, I want to even tell you that if you see the level of violence that we have recorded, a lot of people are so angry. When they get angry, they beat their children to stupor, beat their wives even beat husbands. Because of the frustration, there's really no money and nobody wants to hear about the virus. So, but I prefer that. I like to organize less and organize more. But in organizing more, we continue to see several loopholes. Now, the way forward, we have gotten right from February 27, when we had the first index case, when it wasn't just numbers. We've seen developed countries that have the infrastructure, they are, in terms of their economy, there's boom. When you compare such sharp contrast with our own country, but instead of us to look at the very bleak future, I still believe that now is the time for government to act. All these palliatives that we are talking about, a lot of people have not even gotten palliatives. Some people even complain that they are dying of hunger. So what we need to do, even the government have a way of getting to know what we say. It's very easy to disseminate information, but when you want to disseminate information to those people in the rural areas, it's a tough order. But we just want to plead that as much as possible, maximum awareness must be created so as to avoid fatalities. Again, the isolation centers, we need to have more. We look at the figures, we look at the numbers. We can just say, what's 782 compared to thousands and millions? We are just getting to the starting point. A lot of people have not been tested.
Yeah, yeah.
So
yeah,
let
me take you up on the issue of testing, because the federal government has actually come under knocks with regards to its low testing capacity. I mean, as we speak, but based on the records of data that is being churned out by the NCDC, we have Nigeria has conducted less than 10,000 tests overall. Shouldn't the government be ramping up its testing capacity at this point in time so that more people are tested and we have more testing centers?
I think getting to test a lot of more people is what is in dire need now. A government that has told us from day one that before we had the first index case, that they've been prepared to tackle COVID-19 headlong. But as we speak, most of the centers, now we have over 25 states out of the 36 states and FCT that we have. But where are the centers? Okay, about 1,000 people can be tested in a day, right from what I read, through the social media yesterday. But a population of close to 200 million is nothing compared to those that, the centers and the locations that we have now. Now is the time for the government to declare a state of emergency in terms of testing, in terms of location, so that a lot of our people are not infected, so that people will not just die. We had time to prepare, but now time is no longer on our side. We need to get to hear of more centers, locations where people can get them, rather than the piecemeal that we'll have. Well, people will tell us that critics, theirs is to knock the government always. Well, government has tried. I know what Lagos State government is doing. I know what some other people are doing. But now is the time for us to do more. We don't have testing centers that can meet all the population that we have. And like I said, a lot of these are not symptomatic. So they keep affecting one person or the other at any given time. But the moment they are tested, then they will be isolated. They can be adequately taken care of. And now is also the time for the government to let us know how many hospitals, apart from government hospitals, they will be involved in this testing, so that at the end we don't muscle, the whole thing, and then information will no longer be useful for the people that is meant to meet.
Now, let me ask you, earlier on you mentioned the fact, talked about the poor and the vulnerable within the society. There are reports of domestic violence that are climbing. As a matter of fact, we are projecting that more women and children are facing sexual gender-based violence now because they are stuck at home with their abusers. What should be done to defend these marginalized and prioritize these overlooked ones?
In fact, we've received several calls all over the country about violence. Children, women, and few men too have reported that their wives are beating them. And now that it's impossible for us to have physical contact, what we need to let people understand when we have our calls is for them to go to their immediate community or association. Some of them have association, they live, the environment, the community where they live. Let them report. As soon as they report, they get back to us. And then we'll continue to interface with that person. And if it's so violent, then the situation where, the police station where that person lives will get the DPO, will get someone and involve the person so that the abuser can be taken away. Again, it's also very dangerous for anyone to be abused and they keep mute. The moment the person dies, there's no remedy.
Finally, Doctor, let me just quickly ask this question. Everything hinges on how well citizens are informed about government plans and public health advice. What kind of support are you providing in order to ensure that more people or more Nigerians are actually enlightened with regards to the risk associated with the coronavirus or COVID-19?
Well, ours is that the beauty about Women Arise and Center for Change is that we'll have branches in about 23 states of the Federation. And then we'll have our coordinators who also have, you know, the zonal heads, the members. So they get to disseminate information at times through WhatsApp group. At times, we'll have some of them that are in the market, they are leaders. They get to speak, you know, with some of them, because some of these people will just tell us that, oh, this COVID-19 is a thing that they have had before, and then taking all these local herbs can cure it. So the need for them to be well informed, ensure that they are safe, also prepare themselves that even if they have to move out of their homes, they will keep those physical contacts, and then the less will have the spread of the pandemic. And that was why when we had our people going through public buses, going through train, you know, those are the easiest way for, you know, for people to contact this virus. But more importantly, as we continue to confront and fight this virus, let us remember that Nigeria is like the headquarters, you know, of poverty. Our people are impoverished, and hunger is even more, can be more dangerous and deadlier than the virus. Let us also remember, we see the police boss always talking to the rank and file, educating them. Let these people on the streets, the police who are expected to enforce laws, to ensure that there's peace, let them know that it is costly demands that people should be treated in a dignified manner. Citizens themselves must also know that we are in very difficult times. They must sacrifice. They should also know that we only have one life. And the moment that life, you know, is not protected, anything can happen. Anyone who is dead cannot come back to life. And we must salute our media. We must also salute, you know, Sahara Reporters, Saharatv, for the massive work that this media is doing in ensuring that we have day-to-day updates, in ensuring that people will reach out to people, and in helping to disseminate information as fast as possible.
Dr. Joe, we really appreciate your insightful analysis. We hope that we could reach it back to you as the situation unfolds with regards to the coronavirus pandemic in Nigeria. Thank you very much for your assessment.
Thank you, my pleasure, Luis.